In the fifth and final section of our lecture, let's talk about the perforation of the nasal septum. In this, we will talk about what are the different causes of perforation of the septum. Again, how the patient with perforation in the nasal septum will present and how we can manage or treat this condition. Traumatic perforations, if you see in this diagram, this is the perforation in the nasal septum and there is a hole in the nasal septum. Traumatic perforations that occur as a result of trauma to the nasal septum can occur. This is trauma can occur and leads to perforation. Injury to mucosal flap during SMR, submucosal resection. This is a surgical procedure we mentioned in the previous section that is performed to treat DNS or deflected nasal septum. So as a result of this surgical procedure, if there is injury to the mucosal flap, this can lead to perforation also. Cauterization of septum with the chemicals or galvanocautery for epistaxis. So if there is cauterization performed or if there is galvanocautery which is done for epistaxis or bleeding from the nose, all these can cause perforation, and all these are known as traumatic perforation because they are mainly as a result of trauma to the nasal septum. Habitual nose pricking. If the nose is constantly pricked, that can cause nasal perforation or septal perforation also. And this is the nasal speculum. Nasal speculum is the instrument that is used to visualize the interior of the nose. So once inserted inside, it's open and then you can visualize the inside. So nasal speculum is being used. Pathological perforations. Any pathological is the term used for any disease processes that can lead to the perforation of the septum. Abscess, as I mentioned in the section when we talked about the abscess, septal abscess, that the complication of septal abscess, it can lead to the perforation of the septum as a result of necrosis of the septal cartilage. So septal abscess is one cause of perforation. Then we have nasal myiasis condition, which is the a fungal infection of the nose, can also lead to the perforation. Rhinolith or neglected foreign body pressure necrosis. If there is rhinolith, rhino is the term used for the nose, lith is the stone. So any stone in the nose, and if there is sometimes the foreign body get obstructed, and if those foreign bodies are not removed as a result of pressure on the septum, this can lead to the perforation of the septum. Chronic granulomatous condition also can lead to the septal perforation. Wagner's granuloma is another condition that leads to the perforation of septum. Then what are the different drugs and chemicals that can cause perforation of the septum? Drugs like prolonged use of steroid sprays in nasal allergies can cause perforation of the nasal septum. Cocaine addicts, people who are addicted to cocaine use, they can have nasal perforations also. And the workers in certain occupations like chromium plating, dichromate, or soda ash manufacturer, or those exposed to arsenic or its compounds, they can have nasal perforation also. So nasal perforations, we can have perforation as a result of trauma or injury, perforation as a result of different conditions or different diseases that leads to perforation, like septal abscess, Wegener's granuloma. All these are the different conditions that can cause perforation of the septum. Then thirdly, the use of different drugs and chemicals, in which we have cocaine, and then steroid use in allergies, and then soda ash manufacturers. All these can have perforation of the nasal septum. Clinical features, how the perforation will present. There is small anterior perforation cause whistling sound during inspiration or expiration. So during breathing, if there are small in the anterior part, small perforations, these can produce whistling sounds. Large perforations develop the crust form as a result of perforation, which obstruct the nose or cause severe epistaxis when removed. So if the perforations are large, they can form the crust, and when the crusts are removed, they can cause the bleeding from the nose also. Treatment of perforations: biopsy from granulations or edge of the perforation, depending on if it is from the granulomatous conditions and if granulations are present. Surgically closed by plastic flaps. So they can be closed by using plastic flaps. Alkaline nasal douches and application of a bland ointment which cause the nose free of crust. So that was all about our lecture, diseases of the nasal septum, in which we talked in detail about the fractures, hematoma, abscesses, and also the perforations that affect the nasal septum and how they can be managed and treated also. So hopefully you learn a lot about the diseases of nasal septum after listening to this lecture. Thank you for watching sqadia.com.